Good morning, everyone. Thank you for making it out for the most recent in our series of food policy events here at the CUNY Urban Food Policy Institute at the Graduate School of Public Health and Health Policy. My name is Craig Willingham. I'm the Deputy Director for the CUNY Urban Food Policy Institute. We're a research and action center, again based here at the Graduate School of Public Health and Health Policy, and we focus on a wide range of food policy, research, evaluation, and public events. And today, we're going to be focusing on a topic that we've done quite a bit of work in and we're very interested and passionate about, and that's food security. And particularly, the nature of what's happening at the federal level with many of the proposals that have been put forth by the current administration and Congress really gives many of us pause about what this means for the future of some of the most valuable programs that support the most needy in society. And we're looking forward to having a great, robust discussion today. And again, thank you for coming, and we hope that you'll enjoy today's forum and that you'll attend some of the other forums that we have in the future. Typically, they're monthly, so keep an eye out for your inbox for those of you who are subscribed to our mailing list, and for those of you who aren't, if you could sign in before you leave so we make sure we have your information and we can get out the word about these events. So with that said, I'm going to turn it over to Jan Poppendeick. She is one of the cornerstone members of our institute and a well-versed person to talk about this topic, because she's been researching food insecurity for years and really I think is one of the people who is a prime example of someone who could shine a light on some of the issues that are in the offing today. So Jan, I'm going to turn it over to you.
Okay, thank you, Greg. Greg. Before I introduce our panelists, I'd like to invite the folks on the far left to relocate closer to the center, because it's going to be a conversation. People are not going to be making presentations from the podium. So there are seats on this side of the room or this side of that section, and make yourselves comfortable where you can see and engage with our panelists more readily. It is my pleasure and challenge to moderate this conversation, and I think we're really lucky to have the collection of, sometimes I think of them as the usual suspects, but to have rounded up this collection for this morning, because this is a crucial time in the evolution of food security policy in the United States. As you all know, the Farm Bill is now in play. We're going to be talking about some of the highlights and lowlights of the House version, H.R. 2, which is being debated. Oh, well, Congress is probably not up and awake and working yet, but is being debated today and tomorrow, with the expectation of a vote tomorrow, was the latest thing I read. So let me introduce our august panel. Starting at my right is David DeVaughn, who is the Director of Policy and Community Engagement for City Harvest, working with New York City-based food rescue nonprofit since the fall of 2013. And David strives to use policy and the systems lens on food security work and supports a team of 5 community engagement managers as they organize to connect the root causes of food insecurity to hyperlocal and citywide campaigns. I think many of you have crossed paths with David or heard him present, and we're really glad to have him, and we're going to put him on the spot to represent his work as a coordinator of NYC for CNR, New York City for Child Nutrition Reauthorization, to remind us of some of the other lurking policy issues beyond the current Farm Bill. So thanks for joining us, David. Next to David is Dawn Secor, who provides technical assistance around SNAP for Hunger Solutions New York. Dawn is bringing us the statewide perspective, and she has worked since 2007 at Hunger Solutions, and I think many of us have had occasion to turn to her for technical assistance, and we're really glad to have her with us this morning, and we appreciate her making the journey down from Albany in time to be here despite subway slowdowns and what have you. Thank you, Dawn. And next to Dawn is Chef Greg Silverman, who is now the Executive Director of the West Side Campaign Against Hunger. Greg has worked in the food security space for a long while and in a variety of roles, and has studied at the City University of London, and we're interested in building relationships with our sister university in London, so we're especially glad to have Greg joining us this morning. And next to Greg is Triada Stampas, and I'm tempted to use that old who needs no introduction, because I think if you've worked at all in food security, you've had opportunity to turn to Triada for expertise. But Triada is the Vice President for Research and Public Affairs at the Food Bank for New York City, where she leads the food bank's advocacy efforts, which have been essential to the protection of food security policy in New York. So thank you to all of our panelists. My job is to mostly keep the conversation going. So I want to start out, we have a structure for this morning's conversation. We're going to do a little bit of overview of the current state of food security in New York City and New York State, and then we're going to turn to the current threats to food security, focusing first on the Farm Bill, but then turning to include some of the other threats that are lurking out there. And then at the end, we'll spend at least a few minutes on opportunities that our panelists can identify for making things better. Okay, so panel. We hear all over that the economy is better. The unemployment is down. The stock market is roaring. At least the economy is better for millionaires and billionaires. What is the state of food security? Triada, I want to start with you and ask you to tell us about the meal gap and what it's showing us in terms of.
Sure. Thank you, Jan. And good morning, everybody. Quick show of hands in the room. How many of you are already familiar with the term food security or food insecurity? Great. How many of you could say that about folks you know outside of this room? Friends of yours, family members, familiar with the word food security, the term, what it means, how to use it? Okay, so that's why, part of the reason why the meal gap exists. What the meal gap is a different way to talk about, to measure food insecurity, because food insecurity is pretty wonky. It is pretty abstract. It is what policy professionals use to measure hunger. There is an 18-question panel that the USDA developed that the census issues every year as part of the American Community Survey, and an index of the answers to those questions determines whether a household is food secure, food insecure. And if they're food insecure, do they have very low food security? If they're food secure, are they only marginally food secure? So this gets like pretty technical. And most people may not understand what all that means in real life. What the meal gap does is it translates that wonky abstract concept into something a lot more concrete for most people, which is missing meals. If a person is food insecure or a household is food insecure, they do not have sufficient food to meet their family's needs over the course of the year. And that can show up in a bunch of different ways. It can show up in sacrificing the quality or variety of food. It can show up as sacrifices in the quantity of food. And so what the meal gap does is it translates that shortfall into how many meals are missing, how many good meals, how many meals of a food secure household are missing in those food insecure homes. And so when you talk about a food insecurity rate, you know, in our city, it's been going down, it's been trending downward over time, over recent years, because we are, you know, that's reflective of national trends and economic recovery. the percentages don't mean anything to people. When you can say New York City is missing 225 million meals over the course of a year, that says something to people, because that's something that then is actionable. Like, what can we do to fill that gap? And so that's the meal gap. What's also great about the meal gap is that you can localize it. You can take a look at a pretty fine-grained level to pinpoint where hunger is and what communities are most acutely impacted by food insecurity. And so for an organization like mine, we use the meal gap in a way that we'd never be able to use food insecurity by itself to target interventions. We not only supply food to food pantries and soup kitchens, we help people enroll in SNAP, the food stamp program. And we provide free tax assistance for low-income workers so that they get their earned income tax credit. Those are ways of helping fill the gap, and by knowing where the gaps are greatest, we can target where we're doing our work, because we may be a large nonprofit organization in the anti-poverty and anti-hunger space, but we are not resourced anywhere near what it would take to do all the work, to fill all the gap via all of our different interventions, and so we need to prioritize, and it helps us prioritize. So New York City, 225 million missing meals over the course of a year, but what I want to add to that is the targets to food insecurity, or the two key interventions that we have to address it. First and foremost is the food stamp program. And SNAP in our city provides more than 1.2 billion meals for people over the course of a year, bought at retail. People use their EBT card. It is almost $3 billion worth of food every single year in our city, more than $1 billion of that in Brooklyn alone. So again, we can pinpoint these numbers too and see where the economic impact is. And food pantries and soup kitchens end up in our city oftentimes filling in the remainder, because we are a very expensive city. The cost of food is very high in our city, but also the cost of other things that people can't sacrifice as much, like the roof over their heads. And so once those SNAP benefits run out, there may not be other money for food. And a food pantry or soup kitchen is often what fills in the gap. And for what SNAP provides in our city, in 2 months, it takes an entire year for every food pantry and soup kitchen, with every supporter, with my organization, with City Harvest, with all the other supplying organizations and the government commodities and things like that. SNAP provides more meals in 2 months than the entire system of emergency food providers does in New York City in a year. So, you know, when we get into the Farm Bill conversation and we're talking about you know, what's targeted for cuts and what isn't, keep in mind that notion that the backstop against hunger, that very last stop, which might be a food pantry or soup kitchen, is much, much smaller in scale than the government safety net that SNAP provides. I'll pause there.
Great, thank you. Greg, tell us what you're seeing on the ground at the Westside Campaigning Against Hunger.
So at the Westside Campaigning Against Hunger, we work with a community of about 10,000 families who come to our food pantry and our mobile market and get services from us, whether it's signing up for SNAP and housing and healthcare, our chef training program. What we see every day, first and foremost, is it's really difficult to be food insecure in New York, right? The non-working New Yorker is the hardest working New Yorker in this city, right? They are the folks who are traveling not just to, if they come to my pantry, they're going to another pantry as well, most likely. They're going to multiple pantries and food outlets per month just to get by. And this takes time, and it takes, you know, a lot of physical and mental effort and anguish to do this. And so we're seeing people in pain, right? We're seeing people showing up every day. And oftentimes now we're seeing people who don't want to show up because if you're undocumented, you might be afraid and worried about what you're hearing in the news. That, gee, I don't want to come to the Upper West Side to this pantry because I don't know, is ICE going to be around today somewhere when you hear these different rumors. So we bring our food pantry to our mobile market out into the community to go where people actually live and in their neighborhoods. And we're finding some great success there, and people are excited about that. People want to, right? This is not a question of income level. Everyone wants to feed their family well. Everyone wants to eat well, have great food, and that's what we try to do. So what we're seeing, right, is people who are struggling. It's nothing new. Our 10,000 families each and every day show up. Many of them show up to volunteer with us because they are the change makers of our community. And so we rely on them. We work with them. We are all one. But it's troubling each day for us to see this process, right? We're trying to scale up the amount of produce we give to people, so we're up to 34% fresh produce, which is great. But at the same time, we have to fight when there's a can drive and we get some inferior product, what do we do with it? We don't want to give it to our customers. And we'll get into this farm bill discussion, as we move into cuts to SNAP, right, charity becomes some sort of bigger answer and is a terrible answer. Like, we are not the answer for public policy. And so we're going to be, are we going to have to shift back from this idea of, giving people a hand up and instead just a handout is what's okay? Like, for us, we have to set that line. And so it's a really tricky point for our customers as well to be like, well, I just want to feed my family. Well, but how do I hold to a certain level of dignity? And that's what we're pushing, and it's really difficult for all the families we see right now.
Outside of New York City, where are the biggest gaps?
Sure. And Hunger Solutions New York is a statewide anti-hunger organization. We have folks on the ground throughout New York State through the SNAP Outreach Grant. And so those folks do application assistance for SNAP and work on barriers and work with their local DSSs or HRA here in New York City. So we do get a lot of our information, and we do look at or try to come up with high need areas when we're looking at giving out the NOAA grant on a 4-year cycle to make sure that we are covering the communities that have the highest need. I'm sorry about this. You all, hopefully some of you will not have this problem, but as you get older, and I have not figured it out yet, I don't know how to look at people and read, and it becomes very confusing. But food insecurity in New York State, what I looked at was the Feeding America meal gap of 2018, which looks at 2016 information. So we've determined from that 1 in 8 New York residents lacks enough food for an active, healthy life. That's about 2.4 million people, or 12% of our population. I know, Jen, you said outside of New York City, but when you looked at the numbers lined up in the counties, unfortunately, New York City really jumps out because they have rates for the highest ones of 18, for Kings County, 18.2%, Bronx, 16.1%, and Manhattan, 13.3%. The rest of upstate, the top would be 13.4% for St. Lawrence, which is up by the Canadian border. Jefferson County, out in near Watertown, Chemung, which I'm not exactly sure where it is, but I think it's in the southern tier. I didn't look it up this morning. And Erie County out near Buffalo. So those would be the top places when you look at the percents across New York State. But then when you look at child food insecurity, numbers really change, and it goes up for a total in New York State to 17.9% across the state. And you have different counties and much higher numbers. Montgomery County, which is close to the Capital District and our state capital, is 22.8% of kids in that county live in food insecurity. Oswego, 22.6, Allegheny, and Chautauqua are at 22.4. So interesting that just looking at a different population really changes that dynamic. And then in terms of SNAP participation, it's pretty much spread equally across New York State. About 15% of people in metro areas participate, 16% in small towns, and 14% in rural areas. So we have about 1 in 7 in rural and metro areas participating, and 1 in 6, and this is households, in small towns. And that's a little bit more close together than the national numbers are.
So, it's
Sherry is reminding me to talk into the mic. So we go like this if you can't hear us. But it reinforces our sense that we have a big job to do here in New York City, and we'll do it in solidarity with our colleagues throughout the state who are working to reduce barriers and help people in a variety of areas. Your comments about the high rates of children living in food insecure households is a good segue to my question for David, which is a question of a little child nutrition sector over the last couple of years. So maybe fill people in a little bit on that change in the food security overview.
All right. Good. Is this on? Okay. Good morning, everyone. So first I wanted to say, so I'm from City Harvest. We work with about 500 different soup kitchens and pantries, emergency food providers throughout the city, and we focus on providing fresh produce. So we're a food rescue organization. So you'll see our trucks. We're going to restaurants. We're going to supermarkets. We're going to green markets and others to rescue food that we then distribute out. And one thing that I just want to share that connects to what Triada and Greg and everyone was saying is that we're seeing a lot of people travel. I just wanted to start by saying that we're seeing a lot of people travel. So we've had mobile markets going for years, and they started with having kind of a zip code component, that if you're in this zip code next to this NYCHA house, you are getting this mobile market here with usually a variety of 4 to 5 produce items, nutrition education, other sorts of tabling. And let's say it's at the St. Mary's Market in the Bronx. We're seeing people go from the edge of the Bronx to the St. Mary's Mobile Market. We're seeing people go to the Bedside Mobile Market all the way from way out in Brooklyn to come to chase produce because it's harder to get at other emergency food providers. The other thing that we're seeing are demographic shifts. So at a market where it may have been primarily African American, English speaking, we might now be seeing Russian populations. Another market we now might be seeing all different sorts of Asian populations and South Asian that we weren't seeing. So we're seeing demographic shifts also throughout the city, which makes us have to think about how are we being, what's a good terminology? Maybe it's like culturally astute, thinking about what is the variety that we're providing at these sorts of emergency food providing sites so that people can get what they need and what they may want to use in their homes. So I wanted to start off by saying we're seeing those sorts of things. In addition to realizing there are a lot of areas in the city that there may not be that many emergency food providing outlets, then we need to think about how are we supporting, like Greg is saying, bringing mobile markets around. How are we supporting people to help open up pantries or support pantries in areas where they may not have been getting the same amount of food as other sites, and we're figuring out there actually are a huge population there that live close to something, but then they get their pantry items near where they work, or they get it near where they need to go to government offices. There's all sorts of factors that are at play that we're thinking a lot more about. So on the child nutrition, side, which is, it's funny because this is kind of like a nice rosy, we can start with this. So how many of you all were familiar or tracking the Healthy Hunger-Free Kids Act in 2010 into 2012, where we saw some big wins in terms of the way that school meals summer meals, those sorts of things are administered throughout the country. So we saw conversation around whole grain requirements and saying we want to move these institutional meals towards being 100% whole grain. We saw requirements around fruit and vegetable half cup meals. We saw an analysis and a scope being put on sodium and saying what is the sodium level in these meals and how do we start to reduce it to help the healthfulness of these children as they're learning and playing in the schools that we send them to every day. And also paying attention to the food that's in the vending machines and that's sold within these schools to say, okay, what is in the vending machine? I know that when I visit schools now, you see that, that kind of action-oriented RF, which means reduced fat, so it's different than the Doritos you see in the bodega than you're seeing in the vending machine in the school. So that was another part of that work. So we're seeing that the institutional food at the federal level is being supported and moving in a positive direction towards healthfulness. We can have a whole nother conversation about the reimbursement rate and if that's adequate for the schools to be able to provide this food. But that was something that was really positive that we saw through that conversation. And then I know that Triada will be upset with me if I don't mention that there was also a reduction in SNAP benefits to help support those changes. So seeing 6 cents additional per meal, all these different things were at the expense of SNAP cuts. So that's another thing that we have to think about when we think about emergency food and food security, is if we see amazing nutrition incentive programs, if we see amazing new farmers market promotion programs, what is that at the expense of? Is the money being taken from the SNAP program, which is providing these billions of dollars into New York City, or is it new money, which I don't know if there is such a thing, but is it money that's on top of the money that's already being provided to help support families that are struggling? So we can talk about some of the threats to CNR that are occurring later on.
If I could jump in. So I'm really, really glad David brought up this issue of pay for, and it's something that shouldn't just make me upset, it should make all of us upset that the pay for some of these nutritional improvements in school meals were by reducing SNAP benefits. And it was the first time that SNAP benefits were cut across the board for everyone in the history of the program. And at the time that the cut took effect, which was in November of 2013, it was something that the White House at the time and members of Congress had promised would never happen, that they would stop it before it kicked in. They didn't. They didn't get that done. And so people lost real resources for the food they need to bring home in order to pay for a really nominal increase in school meal reimbursements to encourage the compliance with these other nutrition standards. And you will hear, if you talk to our school food, our Department of Education Office of School Food, the improvements to the quality of school meals in New York City was not appreciable as a result of this. So for New York City in particular, there was no gain and there was real loss. The month that those SNAP cuts took effect, and people tried to minimize them because they really wanted to push the school meal improvements. So they talked about, it's only 5%, 5.5% of benefits is going to be cut. 5.5% of benefits for people who run out before the end of the month means they're running out faster. And food pantries and soup kitchens across the city saw an increase in the number of people on their lines the very first month that cut kicked in. And it hasn't gone down since. And I think this goes back to your original question, Jan, about talking about food insecurity. One of the other trends that we're seeing, yes, we're in an economic recovery, and there have been some gains. There haven't been gains for everyone. And for the households struggling with food insecurity, what we're actually seeing is their need intensify. In the past 6 years, the shortfall that food insecure families are facing in terms of having enough money to buy the food they need has increased 30%. So some folks who were struggling in the recession no longer are, and that's great. Other folks who were struggling are now seeing their struggle having deepened because costs of living have gone up, and their income may not have. And so and the cost of food certainly has gone up. And so they are farther and farther away from being able to afford the food that they need. So when we talk about the Farm Bill, there are actually some positive measures in the House bill that's currently being debated. Debate started yesterday afternoon, but they're all paid for by massive cuts to SNAP. And I think it's not just me who should be upset by that. This is a statement of what is important, what are our values, and is the right way to get these improvements to take food off of people's tables who may not have any other way to get the food that they need to survive.
Can I just add the other thing that Triada brought up that I think is also really important that we talked a lot about in the Child Nutrition Reauthorization Group is the asks for New York City as compared to the national asks. So that Triada was saying the nominal change to New York City school food, there are very strict requirements that New York City has around their nutritional quality that are not at the national level. That a change at the national level may not have the same effect in New York City, whereas a change at the national level in SNAP, New York City is not going to be able to make up, or New York State, for that loss. Whereas our nutrition requirements in school food, for example, are going to be maintained no matter the level of waivers that the USDA makes around sodium, whole grain, smart snacks in schools, bake sales, etc.
And just to follow up on what David said, New York State actually is disproportionately affected, and people who are hungry are harmed more by these proposals because New York State is more progressive and has taken up a lot of these options that are now being proposed to be taken away. So our state has a lot more to lose than many other states do.
I just want to add I previously worked in Washington, and during that last set of debates and shifting standards for schools and whether it's packaging labels, right? You can line all these things up to like a lot of business solutions that were happening, right? Like putting more money in school food was, in some ways, was somewhat good for the food industry. Like giving them time to update their standards worked out really well. And I sat in a lot of meetings, the First Lady's office, talking about standards and thinking about these things. And no one was talking on the flip side, even though I worked for an anti-hunger organization, on the hunger side related to SNAP. And right, because we're not finding that business case solution for SNAP, like, which is a problem, right? Like the business case solution is there's 46 million people who probably are one of the largest buying blocks of humans in the United States who don't have a collective voice to say, look, this is our purchase power. Like, listen to us. And it's very different when you're from the industry side to say, okay, let's get some more money for school food so we can make sweet potato crust pizza.
So I think this also speaks to a kind of siloing that takes place among advocates. These programs are so technical. There's so much to know that it's very difficult to be well informed about SNAP and know the details of child nutrition requirements and legislation. So it's hard to sustain the overview and the passion for making sure hungry people get to eat. Let's turn to the bill that's currently being debated on the House floor. And I'll just alert you that there are a couple of phone numbers up here. Do you know if the Feeding America calling? Okay, so the top number is a toll-free number, and you should definitely write it down. That's a number that you can use. You'll call it. It will ask you to put in your zip code, and it will connect you automatically with the office of your representative in the House of Representatives. And we hope that by the end of this morning's presentation that you will be ready to call and say, vote no on H.R. 2. And the other number is one you can use anytime That's the number for the Capitol switchboard, and anytime you are able to call, specify the name of your Congress member or senator, and be connected with his or her office. So we'll possibly come back to these later, but let's turn to H.R. 2. Just a little word about the process that produced H.R. 2. Historically, the Farm Bill has been an area of bipartisan cooperation. That's not because members of the House and Senate Agriculture Committees are ethically superior to other members of Congress and committed to bipartisanship. It's because the whole structure of the Farm Bill embraces very different constituencies with very different needs. And the agricultural producers who want price protection and subsidies from the federal government need the SNAP advocacy community. They need the Congress members with large numbers of staff recipients in their districts to vote for their subsidies in order to get those through. And so there's been a massive log roll since the mid-60s. Okay, so it has traditionally been one of the most bipartisan areas of policymaking, and therefore the fact that H.R. 2 was written totally by the majority members of the House Agriculture Committee and voted on a strictly party line vote. All Republicans voted for it, all Democrats voted against it, is I think a new low in Farm Bill history, and has provoked a lot of commentary. But that's the bill on the floor today and tomorrow. And so I've asked each of our panelists to nominate their least favorite feature. Their worst case. We won't cover, it's a huge bill, goes on and on. We won't cover it all, but let's have the lowlights. And why don't we go right down the panel in this order?
All right, it is hard to pick just one. It really, this is a terrible bill, and the process was part of why the outcome is what it is. Although I will say, last Farm Bill, which was, the Farm Bill gets reauthorized every 5 years. Congress often takes more time than that to get it done. So the last Farm Bill took 2 years to get reauthorized. The one before that took extra time. This one has a deadline of September 30th, but is likely to push well beyond it. But the last Farm Bill, they took what was then an unprecedented step of trying to strip out and separate those interests that you typically bring a bipartisan coalition together and vote on just the farm pieces, just the agriculture pieces separately from what's called the nutrition title, Title IV, which is where all of the nutrition programming is. So SNAP, TFAP, which is the Federal Commodities Program. So what we're the process that we're seeing now is part of a longer-term polarization that's been happening over time within Congress that's producing, this kind of dysfunction. In terms of this bill, I will say my nomination or my lowlight pick for this panel is probably something that also is super technical, super wonky, which is but super important because it actually affects real people's lives. There is in the infinite wisdom of whoever wrote this provision, SNAP treats, so I don't know how familiar any of you are with the application process for SNAP. I'm going to assume not super intimately familiar. It does get really technical, as Jan said. But there's an income threshold that makes you eligible to apply. And then there is a whole budgeting process where some key costs of living get deducted out. So it's like you start with this income, you deduct some of your housing costs, your utility costs, childcare costs, and so on and so forth. And then where you net out is what determines your actual amount of monthly benefits. Now, in the infinite wisdom of the policymakers, and this is actually a real lesson in who you center in your analysis makes a difference in the type of policy that you produce, it was decided that housing costs are important, right, to deduct out because we don't want to put people in a position of sacrificing the roof over their heads to afford food. So you deduct their housing costs. It was decided that who your landlord is makes a difference. And if the federal government happens to be your landlord, that your housing costs don't get deducted the same way. And specifically, it's not the rent, but the utility component of your shelter cost that gets treated differently. So a household that is living in privately owned housing that pays a certain amount of rent and a certain amount of utilities gets treated differently in SNAP than the same household paying the same amount in public housing. And the result for SNAP benefits is a much lower benefit level. Some states, New York included, and when I say much lower, on average in our state about $125 a month in SNAP lower. So not trivial, not a few bucks here or there, meaningful differences. Our state and some other states have decided to and have worked on correcting that inequity by, it's a workaround. It truly is. It's a workaround to correct an inequity in the program. Because if you center the federal government in your analysis, then you arrive at the conclusion, well, the federal government's already subsidizing your utility costs, so you shouldn't get to take another deduction. If you center the family, the individuals who are affected in your analysis, they are paying what they are paying. They ought not be treated differently from people paying the same thing to somebody else, right? So some states have seen this inequity and taken a measure to correct it by extending benefits through, there's another federal program called the Low Income Home Energy Assistance Program. And anyone who receives this LIHEAP benefit gets to claim the higher utility allowance that would put them at parity with people in privately owned housing. So one of the things this Farm Bill would do is eliminate the ability of states to do that and correct that inequity, and would, for anyone else receiving this benefit, would require them to now substantiate their utility costs by bringing in bills. So it would increase paperwork for a whole bunch of other people too. This would affect hundreds of thousands of New York City and New York State residents in public housing, and in addition, anyone else receiving federal subsidies for their rent, so Section 8, Section 212, and so on. And it would result in the immediate loss of, like I said, about $125 a month in SNAP benefits. And it's, like I said, it's very technical, so it takes a while to explain, but the bottom line is hundreds of thousands of people in public housing would lose a significant portion of their SNAP benefits immediately if this provision were to take effect. So that's my low light.
Okay, and I want to thank Triada for the clearest explanation of the concept called by anti-hunger advocates Heat and Eat, and called by many members of the House Agriculture Committee the LIHEAP loophole. So we have a labeling disjuncture here. That's the clearest explanation I've ever heard. And it does speak to the need for people who want to be effective anti-hunger advocates, food security advocates, to pay attention to policy details that can sometimes sound like you're jumping into the thicket. So moving along, Greg, would you pass this mic to Dawn? And would you nominate one of the aspects of the bill?
I'll use another acronym, ABODs, so able-bodied without dependence. So I won't be as clear and detailed as Triada. Maybe it's my chef brain doesn't work that way as much. But, you know, the idea is if you are able-bodied, you're an adult who is of working age, you should be working. And if not, we're going to throw you off SNAP. And this is not new to the Trump administration, right? This was going on under the Obama administration as well. We were fighting it then as well. And even in New York, it's block by block in some of the areas where they've based these ideas. But saying, not only are you going to have to be working, but we want you now to check in with us on a regular basis, because that's what you should have to do, prove that you're actually working, you know, every month or so. And if you're out of work after a short period of time, you're going to lose your benefits. And so what is this going to push? And I think it's going to be even more outside of New York City than in New York, but it's going to push people to take the worst, lowest paying job, to have that job, so that they can go talk to their equivalent of HRA, administrator person, to make sure they're getting their SNAP benefits. So we're taking people who, as I said earlier, are running all over the city to get food for their families at pantries and soup kitchens, and we're saying now take a low-paying, terrible job that probably has very little long-term work prospects for a career, and just take that, because that's the only way you're going to stay on your benefits. So we're really setting people up for no success in the future. Our whole organization is focused on dignity, and this is really knocking people down and pushing people away from any form of dignity when it comes to work and to their lifestyle. We have lots, hundreds of people who volunteer. The majority of our volunteers are customers of our pantry. They want to be giving back. Some of them are looking for jobs, looking for the right job. And in the meantime, they're giving back, just like anyone else would be doing. But this takes that opportunity away from people, and that really is going to put people, in my mind, in a really downward trajectory personally. If you're that person who's like, I guess I just have to take that job. I got my associate's degree, I got my undergraduate degree, things aren't working out right now, but I need these benefits, so what do I do? So this is really another tragic piece of the legislation.
I'd like to just clarify that
it doesn't the new work requirements in HR 2 don't just affect the able-bodied adults without dependents, because they changed the part that applies to people who are providing care for children, so that if your child is school age, if 6 or older, you are now subject to those same work requirements. And this monthly reporting, which is a nightmare in itself. Currently, reporting is every 6 months, recertification. So the amount of bureaucracy that's going to be generated by switching the reporting to monthly is enormous.
And really what it does is it collapses ABOD and puts everyone under a time limit. It takes everyone, every adult who is not exempt, and makes much harsher the sanctions and the what will happen to people if they don't document this 20 hours. It also includes, besides caretakers or families with children 6 and older who would have been exempt before, it also includes people ages 50 to 59, who we know have gotten pushed out of the job economy, who can't find the kinds of jobs that they had before, and who now we are going to take food away from because they can't document, or the caseworker loses the paperwork, which we all know happens all the time, or a child is sick and somebody's hours go down, or the fact that our economy doesn't even provide 20 hours a week for many workers, and although they make people provide availability for 30 to 40 hours a week, they're not providing people a 20-hour a week consistent job, so that they don't have to pay benefits to those folks. So people are in this really bad place, and we're going to add more people to that, and we're going to make it more punitive, so that it starts in the first month of your participation, and the first time that you fall out of compliance, you're off the program for a year. The second time, it's 3 years. And when you take money away from a household in SNAP, even if you're just sanctioning the adult, you're hurting the children and the other people, disabled people, seniors that are living there. And I think we've forgotten that the SNAP program is there when people are experiencing hard times. And so that means when they don't have a job, or when they're between jobs. And there's so much research that shows that people work before and after and during. And the Center on Budget and Policy Priorities has a wonderful, they call it an illustration, but it's this amazing thing. And people in my office who understand this concept We were so amazed, so it's worth looking it up. It came out a month or two ago. And it's an interactive piece that shows how people move in and out of work, in and out of SNAP, and shows that this little small group of people over here are the ones who are not working, and everyone else is moving in and out constantly, and even that group is moving in and out. They have severe barriers to work, and those would be more of some of our ABOD folks who we know we've had trouble being able to help through in upstate counties where we haven't had slots and where we haven't had HRA, who has done the best they can to try to exempt as many people as possible. I had one other thing I wanted to say and I lost it. But anyhow, this is very disturbing and very, very. The other thing is that the money being provided because the chairman is saying that everyone will get a slot, and we're hearing about people self-selecting out, which, you know, again, the examples I gave, if you don't get paperwork in because your child was sick, or if you don't get enough hours, I don't think that's self-selecting to not eat. Those are things that are happening to you because of the way our economy is, not because you're choosing to give up your SNAP benefits because you decided that you didn't need them. So listen carefully to what's being said, because it's not based in reality. It's not based in evidence. There are pilots being done right now that came out of the 2014 Farm Bill to look at how we can help SNAP recipients move into employment and into and out of poverty and into jobs that will provide them with living wages and the ability to feed their families and be more successful. This is not it. And this does not even provide the funding that states would need. New York State will, they're going to give about $30 per person per month. And they're saying that this is going to provide real jobs. We know that it costs $7,000 to $14,000 per person per month. And if you even look at TANF and the $5,000 a year, New York State is going to lose millions and millions of dollars, and that falls on the counties. So this is a really huge, huge concern and would really change the program. And it's taking money, it's taking food off of people's plates to create this bureaucracy of job, employment, and training that is a farce.
So I think the theme is, which is funny, is less flexibility, because the administration talks about wanting to give states and municipalities flexibility to do what they need for their constituents. The other piece that I'll touch on, and I have not really exercised explaining this in a while since CNR, since Child Nutrition Reauthorization, so Jan can jump in on this. But the piece that jumped out to me, well, two things. One is the categorical eligibility piece. So simply, this would mean it's going to be harder for families who are receiving the SNAP benefit to then have their kids or themselves automatically qualify for other benefits that they are legally should be able to receive. And so the one that jumped out to me, because of reading through this and having worked in child nutrition, is school meals. So in New York City, we have universal free school meals right now. So thinking about that, we've seen many conversations around trying to remove the provision. It's called the community eligibility provision or program. People call it different things. There's been a lot of talk to try to scale that back. And I think this is another connection to that, which is to say, we want every single family that's going to be receiving any sort of government benefit to swim in paperwork throughout the year to prove that they should get that benefit, including their kids in school with school meals. And I think this also connects to, and which is not necessarily in the provision of HR 2, but is all of the, I would say, foreshadowing around making people who are undocumented or have undocumented people in their family feel very afraid about taking a benefit or receiving a benefit. So whether it's a school meal, whether it's getting something in a pantry that is government funded, whatever it is, when you think about the SNAP program and all of the draft executive orders that have come out around welfare reform and around public charge, which we can talk about, those kind of signaling are other ways to try to say to people, please self-select off this program if you don't want it to hurt your path to citizenship later on. The other piece that jumped out to me quickly that I think is kind of insidious is trying to work with retailers to get them to track what SNAP purchasers are buying. And they say it's like, oh, it's just about information. We want to understand more about these purchase patterns. But there's been decades of signaling from multiple different constituencies to say, we want to track this data in order to limit purchases of SNAP families. And, you know, I think there's still families that are receiving SNAP should not be able to shop the way that families who have living wage jobs or families who are on SNAP and use their cash and other things to purchase, I think is a wrong direction for us to go in. Because when you look at any studies of the purchasing patterns, they're very, very similar across income groups. It's more that income groups that have more wages buy more of certain things because they have higher wages. But yeah.
Okay. So Sherry is giving me the signal that it's really time for us to move toward our open Q&A. But my agreement with the panel was that we would also have an opportunity to talk about any positives, any opportunities you see on the horizon. And I think also we need to maybe clarify for people who don't make a hobby of following federal legislation, what happens if H.R. 2 passes? What's next? So let me ask Triada to weigh in on that, and then we'll turn to any opportunities you may see in this, and then we'll open the floor.
All right. So as far as next steps on H.R. 2, the vote right now in the House is scheduled for tomorrow morning. So if this is something you do not want your member of Congress to vote for, today is an opportunity still to weigh in. Phone calls in many ways are more impactful than emails. In fact, since the last election, congressional offices have been swamped by communications of all kinds from very engaged constituencies on all sorts of things. So don't be shy about reaching out in whatever way is comfortable for you. The 800 number that's up there is a great way to make that toll-free phone call. And if you don't know who your member of Congress is, you can give your zip code and it will figure it out for you and help you figure it out and connect you directly to the right office. Email is great too. We have an action alert on our website. So if you go to help.foodbanknyc.org/FedAction, Fed short for federal, then you can send an email to your member of Congress as well. That vote is scheduled for tomorrow. Now, to harken back to everybody's sort of Civics 101, before a bill becomes a law, it has to pass in both houses of Congress. And the Senate still hasn't made a move. The bill that we have out right now is the one that's in the House. What the Senate Agriculture Committee has signaled is that they will not accept the House bill as their bill. They're more or less starting from scratch. And they have said that they're going to prioritize drafting a bill in a bipartisan way. So the process, the dysfunctional process that Jan outlined at the top of this panel is going to look different in the Senate. So they're working on a different timeline. They have not yet come out with their bill. Before anything, past tomorrow, before anything else can happen on this farm bill, the Senate will also have to release its draft in the Agriculture Committee, have the debate, the markup, the amendment process, and so on. And at the end of that, the House bill and the Senate bill ultimately have to be reconciled before it can go to the White House for signature by the president. So the differences between the two bills are likely going to be pretty significant. The conference process to reconcile differences could be long and drawn out. We may very well like I said, the deadline for reauthorization this year is September 30th. This is likely going to take longer than that. The Farm Bill is a very complicated piece of legislation that has a lot of stakeholders, and the longer it goes on, the more opportunity for stakeholder groups to pick apart the language, which is a healthy, good part of a democratic process, and weigh in with what their concerns are, what their needs are, what opportunities they see to make improvements. And I think we also can't take for granted, so just because a bill is scheduled for a vote tomorrow doesn't mean that it will pass. This Congress has brought bills up for a vote before where they thought they had the votes to pass and didn't. And we saw that with healthcare reform, with that very first attempt at healthcare reform. The bill was brought up for a vote and it failed. So reaching out to your member of Congress now still has an impact, still is important. And if that bill fails, it'll get sent back to committee. So the House may take another stab at it if it doesn't end up passing and come up with something else, and we don't know what that something else is, because right now it is a one-party bill, but factions at opposite ends of the political spectrum within that party are disagreeing with elements of the bill for different reasons. So just today, House Tea Party conservatives, the Freedom Caucus, has taken issue with the bill because they don't think it goes far enough with things like work requirements. They don't think it goes far enough in eliminating agricultural subsidies. They don't want, farm welfare either, is the way that they're putting it. But Republican moderates are also raising concerns about things like cuts to SNAP and whether the work requirements are well designed or whether they'll actually harm people. And so the margin for passage is really thin. There need to be 218 votes. There are 235 Republicans in Congress, and there are 20 members of the moderate group. They're called the Tuesday group. There are 35 members of the Freedom Caucus. If members of either of those factions decides to vote no in significant numbers, this might not pass. So that's a possibility too.
So welcome to the fascinating politics of the Farm Bill. Thank you, Sherry. In my happier moments, I think we may be able to delay this until after the midterm elections, and then it's possible the control of one or more of the houses of Congress might shift, and then we would have a new ball game. But that doesn't mean that you shouldn't pay attention to what's in H.R. 2 and make your voice heard, because that sends a message to the Senate as they work on their bill. It sends a message to members who may be wavering in one direction or another. So please, if you have a feeling about this, make a call. I think that in deference to our audience, we may have to restrain our opportunities in response to questions from the audience. Any mutiny on the panel? Okay. Ready for questions and comments from the audience. And we'll keep 2 mics up here, and let's keep 2 up here for answering.
I know many of us, my name is Tanzina Ahmed from Bronx Community College. I know many of us are probably affiliated with CUNY or some sort of graduate school, or we have colleagues or coworkers here. What do you think CUNY can do specifically to address these concerns? And can we make an impact that goes beyond our student body into the larger neighborhoods our institutions are embedded within?
I think I'm going to answer that question. And could I ask the members of the CUNY Food Security Advocacy Project who are here in the audience to raise your hands at the moment? Okay, if you turn around, you'll see a number of CUNY students who are, as we speak, being trained as campus food security advocates, primarily to reach out to fellow students to help people connect with resources that might be available, because we have a major food insecurity problem at CUNY. My hope and vision for our Campus Food Security Advocate Project is that we would equip and empower students to become effective advocates, not only on campus, but also in their communities. And some of that has to do with people mastering enough of the technical components of these programs to answer questions accurately, to steer people at least to where they can get answers to questions, to help connect people with resources. And some of it has to do with destigmatizing these programs, to get the message out there that if you are eligible for SNAP, it's responsible parenting and responsible self-care to take advantage of it, to make use of it. We need to change the conversation around SNAP and other food assistance benefits, and I think CUNY can play an important role in that. We are hoping to recruit some faculty food security advocates to maybe introduce some of this material into courses at CUNY. So thank you for that question.
Hi, morning everyone. So Channel Alto, I'm actually from the Caribbean. I'm a public health lecturer. I'm worried about the sustainability of food programs, and I hope to translate some of the lessons learned probably back in the Caribbean. What I see really is that we are getting stopgap measures to try to mitigate against rising food costs and problems associated with that. I'm wondering to what extent anyone can probably address the issue of maybe marketplace regulation of the price of food, because all over the world when I travel, I see food prices going up. And basically what you're doing is that you are going to get more and more people in need of support. So therefore, I'm not sure with the enactment of legislation and think what we can do about that, but really and truly, can we seek to regulate the price increases? Because there seems to be no correlation between the price of food that farmers or farmers produce and what actually goes on the shelf. I hope my point is clear. So really it's about marketplace regulation for the long-term sustainability of programs.
I mean, I would start and just say, I think under this administration, we're not going to see much of that. But I'd say, I give an example in the sort of free market side of things, like what's possible. Like in New York, we at the West Side Campaign Against Hunger are working with the largest food pantries in the city in building out a model of collective purchasing to get food at a better price on the free market. So we can purchase more from upstate farmers who are going out of business and get healthier food to our people downstate. So I think there are some free market approaches. I would love to see the bigger it's sort of like the farm bill in general. Like there's a lot of big picture things we can talk about, but there's some things we can actually do on the ground while we wait for policy to wishful thinking go our way. But yeah.
And I would just say that like the agriculture side of the farm bill is has some role in this, but just to give you an example, and there was an article in the New York Times not that long ago, dairy farmers are committing suicide at rates that have never been seen before. And I grew up in Schoharie County, and I know what dairy farmers are, and they're proud people, and they're generations worth of people who have produced milk and worked hard, and they're losing their farms, and they're killing themselves because they think that's the way that they can help their families by getting the insurance when they die, so that the family doesn't lose the whole everything. They are not making money. They cannot get the money that it costs them to produce the milk, and it's just so it's heartbreaking. It's really heartbreaking. So I don't know that that's an answer at all, but it's sort of shining a light on the fact that farmers are in this too, and they are really suffering.
Question
What?
from the audience.
One thing I would say is when we're thinking about legislation, that Congress, state, even the city, sometimes is very wary of tying a program to increases in inflation or increases in the cost of something. So we can look at inflation and look how it's being depressed in many ways, the actual cost of inflation right now. So we'll see these small little rates. But then when you look at food costs, it might say 66% over the last 14 years as it's gone up. So thinking about the way in which legislation is written that benefits or support is tied to the actual cost of things would be a step, but that costs more to the city, to the state, to the feds, and so they don't necessarily look to do that on a consistent basis. That's something I've seen come up, but if anyone knows anything on that.
Well, I think we just want to make clear, I think people can hear me, that has been part of the genius of SNAP and of school food, is that reimbursement rates, benefit levels are tied to the index of the cost of food purchased and consumed at home. They're fooling with the rate, the way in which those rates are calculated in ways that will not benefit poor people, and that's another threat out there in the environment. But we appreciate your bringing the bigger picture, but I want to see if there are other questions that address the.
Thank you very much for your comments. You all are veterans of looking to influence food security programs, and I wonder if you could talk from the last few rounds of this. What do you think has been most effective in shaping the program, and what are some of the things that we've all done that are maybe not so effective that we shouldn't repeat but should do something different? And then related to that, what do you think is the particular role that New York City can play in the national debates around food security? How can we make sure that from our experiences we contribute something that will make this battle that's going on have a better outcome?
So I can kick off a little bit. What New York City models that is exceptionally effective. David alluded before to some fissures between the anti-hunger community and the public health community regarding things like choice of, food choice in SNAP. Should SNAP recipients actually be able to purchase the groceries that they want, or should there be a fixed package of food choices that's made for them, right? And that is a simmering kind of difference of opinion within those two communities. In New York City, we have been, I think, exceptionally well aligned on this issue with our public health community. So locally, I think that's something that we've done successfully and been able to say, SNAP benefits ensure people have the basic resources that they need for food, and frankly, those benefit levels are not even sufficient to meet basic needs where they're at now, right? Like the average SNAP benefit is less than $1.40 per person per meal right now. Try buying your groceries on that budget. It's really hard. I've done that. It's really hard. So I think New York City has modeled something really good about saying, as a public health, so SNAP is intended to provide people with basic food resources. This is a survival need, and this is as close as our country comes to a guarantee against hunger, right? It is an entitlement program. We haven't talked about that or used that term here, but it means that anybody who meets the eligibility criteria can get it. There's no waiting in line. There's no waiting, you getting the benefit bump somebody else off, right? So that's really important. And so we call it the first line of defense against hunger as a result. To have our local public health community join us in saying that first and foremost is important. Like, let's deal with adequacy and making sure people have enough so that we can get to the conversation about what is most healthful, how does our food system support healthful eating practices, good dietary behaviors, making sure that people have the education to make the most of their nutritional dollars even when they're on a limited budget, right? Like the acknowledgement from our local public health community that the adequacy of benefits and sufficiency of benefits is a necessary condition for ensuring public health, I think is really important and really successful. That's not necessarily the case everywhere else in the country. That is not necessarily the case among the national organizations in the public health area and in the anti-hunger area. there isn't necessarily that same alignment, and it has been used as a wedge before to make changes in school meals, in the pay for of SNAP for school meals, nutritional improvements was a proposal by national public health groups who prioritized the nutritional content of the school meals over the adequacy of people's resources for food at home, right? And that didn't come from the anti-hunger community. And while Jan is completely right, both programs can get really technical, and it's hard to maintain expertise in anything. I would say you don't have to be an expert in SNAP to know that taking those dollars away for school meals is a bad idea, right? Like, you don't actually need that SNAP policy expertise to be able to make that connection. So we do something really good here in New York City that we don't see necessarily anywhere else. And that's something I think we can take a lot of pride in.
I would add, one of the things I think we saw the last go-round, at least my time in Washington, was good storytelling to the right audiences in the right way. I would travel around the country and lead grocery store tours with congressional representatives. And the messaging changed depending on who I was talking to, whether it's for talking about WIC and talking about SNAP. And just if we were talking about summer meals and I was talking to folks in Waco, Texas, and the Chamber of Commerce, telling them that they were leaving $24 million on the table by not maximizing summer meals in their community was a business case for them. That was the argument that worked for them. And if we don't tailor our arguments to the right group, even if we're like, this is about hungry kids, no, that's not the argument that might not work for them. Everyone's going to do they're all going to go to the soup kitchen on Christmas Day and hand out some food and feel good about themselves and give them a pat on the back. But we got to give the right argument. I was in a congressional office, right, living in New York. Going in D.C. to a New York City delegation is nice, but it was much more effective, I felt, for me to go. I grew up in Utica, New York, to go to a Republican district and talk to the congresswoman who really is all about her farmers and is not really an advocate for SNAP. But I gave my argument about collective purchasing and buying more upstate milk, and they wanted to hear about that because this was just about helping their constituents, which is what we want to do. So I think we've done good storytelling, but we have to be really careful to make sure that we're telling the right story to the right person at the right time.
Any other lessons from prior rounds? I know we are effectively out of time, so I want to thank you for coming. I want to thank our panel who did a terrific job. Take out your phone and weigh in on HR2, whatever direction you're in. This is a free society. I will be checking in. I also want to say that if you want to hang out to schmooze a little bit afterwards, we have the room for a while. We have much more to say about other threats and other opportunities, but we'll excuse people who meet.
And one last bit of housekeeping. I wanted to take the time to invite you to our next forum, which is on June 6th and covers food, trade, and health. What are the connections? For those of you who are interested in the way some of the major trade deals that have been discussed over the last few years, NAFTA, TPP, and how that affects public health, and particularly how that affects the food that we're able to access. I think this will be a really interesting forum, and I hope to see many of you there.